Okay, I'm gonna start this. Good morning, whenever you're looking at this. I'm gonna start off by saying I am in my backyard, so you may hear the school next door to me. We have a school that is right on the back side of us, and we have a park that is, over here on the other side of us. It's on the south side of us. The school is on the west side of us. And I love Fridays because they celebrate. They celebrate every Friday. When I'm feeling good, like today. Yesterday I was feeling well also, but today I'm feeling really good. I'm feeling good. And so I come out here and I sit in my backyard. And they play things like YMCA and some other really cute songs. So you may hear that. The children are screaming and having fun, which to me is really cool. I really like that. Sorry, my glasses are going to be dark. I have to read a few things, so I just wanted you to understand what's going on. I wanted to go over some of the medication that I take. Gabapentin is my biggest medication that I take. I take it every morning. Oh, by the way, I don't have the jerks this morning. So I just wanted to go over a couple of descriptions of the gabapentin. I was just reading again. So my head may be down. And that's why. So I didn't know it was called that. US brand names. Fuse Pax Fenitrex. Gabapentin, Garlice, and Neurontin. It's also called gabapentin, but that's the name that I looked up. I go, everything that I read, I go according to the Mayo Clinic, because I feel as though that's a little bit of the safer description. Gabapentin is used, also we'll hear airplanes and helicopters. This is a very busy, we have a hospital that's also a trauma unit that's just about a mile away from us. This is a very busy area, but it's a very plush and nice area. I love it. Because when it's quiet, it's beautiful. Anyway, gabapentin is used to control seizures, convulsions in treatment of epilepsy. This medication cannot cure epilepsy and will not work to control seizures for as long as you continue to take it. Oh, I'm sorry, I read that wrong. I'm also dyslexic, so take that for what it's worth. This medication cannot cure epilepsy and will only control seizures as long as you continue to take it. Gabapentin is also used in adults to manage a condition called neuralgia, post-therapeutic neuralgia, which is a pain that occurs after shingles. So if you have that continued pain after, I've had shingles. Years and years and years ago, I had shingles, but I had it that went right through here and around my back and underneath my bra. Oh my God, it was the most painful thing ever. Gabapentin works in the brain to prevent seizures and to relieve pain for certain conditions in the nervous system. It is not used for routine pain causes by minor injuries or arthritis. Gabapentin is a anticonvulsant. This medication is available only through a doctor's prescription. This product is available in the following dosage forms: capsule, tablet, solution, and suspension. Before using gabapentin and deciding to use this medication, the risk of taking this medication must be weighed against the good it will do. We all should do that. This medication is a decision you will make with your doctor. For this medication, the following should be considered: your allergies, a pediatric, a geriatric, breastfeeding, drug interactions. So if you're on certain drugs, you should absolutely talk to your doctor. You need to take all your drugs with you and talk to your doctor about it. I'm not going to read all that. I'm not going to go through all that because it's pretty much self-explanatory. If you're breastfeeding, talk to your doctor. If you have drugs, talk to your other drugs, talk to your doctor. If you're geriatric, let's see what that says. Appropriate studies forms to date have not demonstrated geriatric specific problems that would limit useful use of gabapentin in the elderly. However, elderly patients are more likely to have unwarranted effects, problems with balance, walking, swelling of feet and legs. Well, a lot of the swelling in feet and legs could be due to the fact that geriatrics don't move a lot. They do sit a lot. They don't do a lot. And I mean geriatrics as in their 80s or 90s. Now, granted, there are some kicking 80 and 90-year-old people out there. My mom is 73 years old, and she can probably outwork me in a hot minute. So those things you want to talk to your doctor about. If the loved one that is geriatric and does a lot of movement, it may be great for them if they have pain, Neurontin, like Neurontin gabapentin. If they have like, let's say, diabetic pain in their legs and feet, talk to your doctor. If they're really active, hey, go for it. It also goes through the different medications that may have reactions with that. And I'm not going to go through that. You can go to the Mayo Clinic and look all those up because there is 1, 2, 3, morphine. Wow, morphine. The thing with gabapentin, Neurontin, is that it will speed up whatever you're taking. So if you are on he thinks I'm talking to him. So if you're on gabapentin and you want to take a pain reliever along with it, it may speed up what the reaction is. Like morphine would be making you tired. But it also says, why is your tail all wet? That kind of scares me now. It also says magnesium carbonate, magnesium hydroxide, magnesium oxide. So you probably should look at those interactions. I take magnesium and I didn't know that. I will look at those later, not right now. So medication problems, what did that say? Other interactions. Certain medications should not be used around the time. Certain medicines should not be used at or around the time of eating food or eating certain types of food, since interactions may occur. Using alcohol, don't drink alcohol while taking this, please. It's just retarded. If you are on anticonvulsants or pain medicines or anything, stop that. Go away. You shouldn't take or drink alcohol. I just don't understand that. I don't understand that. Why do people do that? Discuss this with your healthcare professional. Okay. Other medicated problems. If you have a history of depression or history of bipolar disorder, you want to talk to your doctor about it. Mood or mental changes, just like I said. Kidney disease. Use with caution. Talk to your doctor about it. It's a very important thing. Let's see. Proper use. What I have learned with this is take it at the same time every day. It's important, at least within, I want to say 30 minutes. It's very important with this medication. For patients with epilepsy who take gabapentin 3 times per day, do not allow more than 12 hours to pass between 2 doses. So if you're taking it 3 times a day, you want to take it according to how long you take it. Now, it's very important for that. I don't let 12 hours elapse during that. Let's see what else it says. Take with or without food. You may break the second. You can break your tablets in half. But I take capsules. I take 300 milligram capsules, and I take four times a day. And I make sure the last I make sure the last dose that I take isn't more than 12 hours to my first dose of the next day. It's very important. Swallow capsules whole. Do not open. Capsules do not open. Crush or chew it. Who would want to do that anyway? Well, I can understand that. If a doctor gave a patient that has swallowing issues a capsule, a nurse may break it open and put it in pudding or something else to help them take that. But ask your doctor to give you a tablet. Unless it's the extended dose, then you have to, the doctor will take heed in that. Dosage, your doctor will manage your dosage. I'm not going to give you all the dosage information. Missed dose. If you miss a dose of this medication, it will take it as soon as possible. However, if it is almost time to take your next dose, skip the missed dose. Don't double up your dose, because you are going to get extremely drowsy. You'll get clumsy. You'll be absent-minded. Believe me, I've done this by mistake, okay? Where are you? Here it is. And talk to your doctor about your precautions. Gabapentin may change your vision, make you clumsy. Believe me, when I first started retaking the gabapentin, I couldn't see, I couldn't walk, it was hard for me to talk. Why are you licking me? Trouble with thinking. Hey, hello. Where's your brother? So enough said about that. Side effects. More common: clumsiness or unsteadiness, consciousness, uncontrolled eye movement back and forth, or rolling of the eye and movements. I had that. I really did, because when they started me back on this, they started me at 1,000 milligrams 3 times a day. And I seriously had some issues with that. More common in children: aggressive behavior, anxiety, concentration problems, crying, depression, false sense of well-being, hyperactivity, rapid change in moods. Wow, that's in children. Less common. Black tarry stools. If you have black tarry stools, you better talk to your doctor, because that means that could be bleeding somewhere. Chest pain. I get the chest pain. I get pain right here. But there's nothing wrong with my heart. It's just chest pain. Chills, cough, depression, irritability. I get the irritability, believe me. Other mood changes, mental changes, fever, which I have not had. Loss of memory. Wow. I take 4,800 milligrams of gabapentin a day. Yeah. Crazy loss of memory. Pain or swelling in arms or legs. I don't have that. Painful difficulty urination. I do have difficulty in urination. I do have that. Shortness of breath. I don't have that. Sore throat. Now, I have had sore throat, but I think that has to do with my the nerve pain that I have. Somebody needs to go to the office real quick. Unusual tiredness or weakness. Now, they have said that throughout the whole entire commentation. Increasing not known. Abdominal stomach pain. Now, I have porphyria, so I have a lot of that anyway. Blistering or peeling or loosening of skin. I have not had that. Clay or discolored stools. I did have that in the beginning, but that's dissipated now. Coma? No, I'm definitely not in a coma. Confusion? Yes. Convulsions? No. Dark urine? Yes. I just upped my water and that got better. Decrease in urine output? I do have that issue. Diarrhea? Yes. I am almost taking 5,000 milligrams a day, so I'm going to probably have some of these unheard ofs. I don't have an irregular heartbeat. Headache? Yes. Increased in thirst? Yes. Oh my God, I have increase in thirst. Itchy skin? Yes. Joint pain? No. I don't have large hive-like swelling? No. Loss in appetite? Hell no. I have put on so much weight. Get that pledge done. Loss of appetite? No. Just like I said. Muscle aching or pain? Not much. Nausea? I have had a little bit of nausea, but that really hasn't kept me from eating. Red skin lesions? No. Red irritated eyes? No. Unpleasant breath odor? Does that include morning breath? Vomiting or blood? No. And if you're vomiting blood, you better call 911. Yellowish skin or eyes? No, I have not had that issue. More common, blurred vision? Yes. Cold or flu-like symptoms? No. Delusions? No. Dementia? Maybe. Hoarseness? Yes. Lack of loss of strength? Yes. Lower back pain? No. Swelling of hands and feet or legs? No. Trembling or shaking? Yes. Yes, yes, yes. So that is more common. And I am taking a very high dose. So again, I'm actually taking, if you go to a regular doctor's office and you tell them that you're on 4,800 milligrams of gabapentin, they're going to go, what? Yeah. So go get your ball. Less common or rare, accidental injury. Now that I think that would be in the more common because you're in the realm of being clumsy and stuff like that. Appetite increased, less common. I am on almost 5,000 milligrams, so that's more common in me. Back pain, I haven't had that. Bloating or full feeling, wow, have I had that? My belly is huge. Body aches, no. Blurring or dry or itching of eyes, yes. And it's not from allergies because I don't have that. Change in vision, yes. Changing and walking and balance, yes. Clumsy or unsteadiness, yes. Congestion, no. Constipation, no. Coughing, no. Or more production of mucus, no. Decrease in sexual desire or ability. Let's get a little personal here. I have really bad PTSD due to a sexual event in my life. So, and I also had a hysterectomy when I was 26. I had a what they call a radical hysterectomy because they had to take part of my V area. And if you don't know what V area is, think about it. The VV, the V, the big V. Mine's not very big anymore. It's very small. So I really haven't had that much of a sexual appetite for a very long time. If my husband wants it, he has to ask for it. And I will never tell him no because he's very good. So, okay, over that. Difficult in breathing, no. Dryness of mouth, yes. Yes. Dryness of mouth and throat, yes. Earaches, no. Well, I've had the ear pain from my trigeminal. Excessive air or gas in stomach and or intestines. Yes. I take 4,800. I'm not going to say that anymore. Yes. Excessive tearing. Well, unless you talk to me on a day that I have depression. I discharge. No. Feeling faint, dizzy, or lightheadedness. Yes. Feeling warmth of hot flashes from HE double toothpicks. Yes. Flushing in skin. Yes. Flushing or redness of skin. Yes. Frequent urination, no. Fruit-like breath odor, no. Increase in sensitivity to pain, no. Increase in sensitivity to touch, no. Increased thirst, yes. Indigestion, yes. Nose and ears. Nose in ears. Does that mean my nose is in my ears? It just says nose in the ears. No. Oh, I'm dyslexic. Remember that. It's noise in ears. No. Shoot. Pain, redness, rash, swelling, bleeding where the skin is rubbed off. Ooh, ouch. No. Passing gas. Yes. Just ask my hubby. Redness or swelling in the ears. No. Redness, pain, swelling of the eyes. Go get it. No. Running of nose. No. Sneezing. No. Sweating. Yes. Tender. Go get it. Fetch. Max, fetch. Tenderness in the chest. Sometimes. Yes, I do. Tightness in the hands and feet. No. Trouble sleeping. No. God, no. Trouble thinking. Yes. Twitching. See? Here are all my issues right here. Trouble thinking, yes. Twitching, yes. Yesterday, especially. Unexpected weight loss. No. Unexpected weight gain. Yes. I've gained 30 pounds. And I'm talking not just in like the last year. I'm talking in the last month. 30 freaking pounds. And they're not worried about it because I'm on a large 30 pounds. 30 pounds. Weakness, loss of strength. Yes. Weight gain. Hello. Yes. Okay. So that is a lot of my issues. Now that I see this, a lot of my issues come from the gabapentin. So if we're wondering where the tics come, the jerking, the twitching, what is it called? See, there goes the thinking. Unwanted jerking. That's where that comes from. Carbamazepine. WebMD, no. Mayo Clinic. Now, I've been on here for 22 minutes, so I just want to go over the side effects with you guys, because a lot of the other things are a no-brainer. Allergy, geriatrics, breastfeeding people, if you're on certain there's a lot of medications on here. So yeah, you need to take, there's a lot of medications on here. I wonder if gabapentin's on here. No, I don't see it. Neurontin? LM? No, it's not in here. Okay. Wow, there's a lot of medications in here. Lithium, those are big medications. That's people that are on anticonvulsants really need to pay attention. Gabapentin, Neurontin is on there. Stevens-Johnson syndrome, which a lot of people have. It's a skin disease. You need to really talk to your doctor before you take this. Really talk to your doctor. And me and my doctor went over this a long extent, because I have things like porphyria, I have hemochromatosis, I've had cancer. So this is something that me and my doctor talked about. It's also called Tegretol. So I'm not going to go over dosages, because that's something that your doctor will go over you with. Missed dose, just like any other thing, take it as soon as you can, but don't take it if your next dose is like 15 minutes away. That's just not smart. I'm just looking for side effects. More common: blurred vision, double vision, back and forth eye movements, which is just like the gabapentin. Less common. Behavior changes, confusion, agitation, diarrhea, drooling, fear, feeling of unreality, feeling sad or empty. Oh, that's me 24/7 without the drug. Headache, increased in seizures. Thank goodness I take the gabapentin. Irritability, lack of appetite. I don't have lack of appetite, and that's probably because I take so much gabapentin. Loss of balance control. And another most important thing that my doctor told me when we were discussing this is you need to have something in your stomach before you take this, even if it's ice cream like I did this morning. I don't always do that. Shuffling when walking, stiffness of arms and legs. I have stiffness in my hands, but I also have arthritis. Talking, feeling, acting with excitement. I do that a lot too when I'm feeling good. Thoughts of killing yourself. No, I don't do that. So it's really important for you to look over things. Let me look through here. Hoarseness. I do have that. I don't have lower back pain. We already went over that. I'm looking at the stuff that I have not had. A lot of these are the same thing as gabapentin. I haven't had that. Not that. Irregular breathing. No. Thickening of bronchial secretions. Wow, if you're an asthmatic, really take care. Weight gain. So this one's also weight gain. I take 600 milligrams a day of this. I take 200 in the morning and 400 at night when I go to sleep. Dizziness, drowsiness, lightheadedness, nausea. I don't have that. Vomiting, no. Increase of not known. Which a lot of these are the same as gabapentin. Dry mouth. I have dry mouth. Headache, heartburn. I have that. Increase in sensitivity to sunlight. I've always had sensitivity to sunlight because I have porphyria, so I've always been that way. Ingestion, yes, sort of loss over here. But this does not have. This also has sexual problems in males. Sleeplessness. I don't have that issue. Stomach pains. So a lot of my issues comes from the gabapentin that I take. Again, I'm only looking at the two that I take the most, which is the carbamazepine or Tegretol. Yeah. So those are the two that I take the most. So I just wanted to go over those with you. So after looking at this, I realized that a lot of my that word I'm looking for, I don't remember. A lot of my movements come from the gabapentin, and it has its own when it comes and when it goes. It never stays the same. So I just wanted to go over those with you, so we all know now that it's the gabapentin. And you know what? It didn't start happening until they went up from the it was 3,200 that I was taking to the 4,800. When I did that leap is when it started happening. And I tried to back off of it. There goes Missy. I tried to back off of it, and it just didn't work for me. I immediately started having pain. So it is what it is. I will continue to take it, and I'll continue to have the jerking issues because I'm just not willing to deal with that pain. I just won't do it. My two little sweethearts are too sweet. Quit licking me. He's a licker. So I love you guys, and I hope you have a fantastic day, and I will talk to you soon. Mwah!